Hello, and a huge welcome to all you care workers out there. This is your go-to guide for medication awareness. We're going to break down everything you absolutely need to know so you can handle this crucial part of your job with total confidence and, most importantly, with safety.
So let's just jump right in, shall we? Managing medication, it's so much more than just a task on a checklist, isn't it? It's a massive responsibility. Over the next few minutes, we're going to cover the essential stuff, the core knowledge that's going to help you protect the people you care for and, just as importantly, protect yourself.
So you might be asking, why all the focus on this? Well, let's start with a number that really hits home. Over 70%. That's how many of the most serious medication incidents happen because of simple, preventable mistakes. Things like errors in administration or supply. That's a huge, staggering figure.
And honestly, that's exactly where you come in. Think about it. Every single time you help with medication, you are that final, critical line of defense. You're the one standing between a potential mistake and someone's well-being. Your sharp eye, your knowledge, your care, that's what makes all the difference. That's what keeps people safe.
Okay, so here's a quick look at our game plan. We'll kick things off with your crucial role. Then we'll get into the rules and the meds themselves. After that, we'll master the 6 rights. That's a big one. We'll cover storage and records and then wrap it all up by talking about what this all means for your commitment to care.
All right, Section 1. Let's talk about your crucial role in safety. It's really about understanding the big picture you're working in. See, it's not just about one single rulebook. It's more like a set of nested layers, and they all have to work together to keep everyone safe.
So think of it in 3 levels, right? At the very top, you've got the big national regulations. These are the laws of the land, stuff like the Misuse of Drugs Act. Then, your employer takes those laws and creates their own specific policies. That's how things are done where you work. And then, the most personal level, the individual's care plan. This is tailored specifically to the person you're supporting. You've got to know all 3 to do your job right.
Okay, so now that we've got that 3-level framework in our heads, let's build on it. It's time to get into the nitty-gritty, the key rules, and the different kinds of meds you'll actually be handling.
Now, don't worry, you don't have to be a legal expert here, but you do need to know the big ones. You've got the Medicines Act, that's all about labeling and sales. The Misuse of Drugs Act is super important for things like opioids. And then there's the Care Standards and Mental Capacity Acts. These are basically the foundation of everything we do, making sure we protect people's rights and keep our care person-centered.
Okay, I want to talk about something really, really important. It's an initiative called STOMP. It stands for Stopping Over-Medication of People with a Learning Disability and Autistic People. It's a huge national effort to tackle a massive problem, the inappropriate prescribing of psychotropic meds. The goal is simple, but powerful. Make sure this kind of medication is a last resort, not a first choice.
And if you're wondering why STOP is so needed, just look at these numbers. It's shocking, really. Someone with a learning disability is 16 times more likely to be on an antipsychotic than someone in the general population. 16 times. For autistic people, it's 7 times. This just screams risk, and you, being aware of this, are a massive part of turning this tide.
All right, let's switch gears to the meds themselves. They're basically sorted into 4 legal groups. You've got GSL, General Sales List. That's your off-the-shelf stuff. Then P for pharmacy only. POM is what you're probably most familiar with, prescription-only medicine. And then CD for controlled drugs, which, as you'd expect, have the tightest controls. The best part? You don't have to guess. It's written right there on the box, so just always take that extra second to look.
Okay, deep breath. We're now at the absolute heart of safe medication practice. This is your everyday, every-time safety checklist. Honestly, if you take away only one thing from our chat today, let it be this. We're talking about the 6 rights of administration.
These 6 things are completely non-negotiable, every single time. We have the right person, the right medicine, the right dose, the right time, the right route, and one that's so important, the right to refuse. Let's walk through them one by one.
First up, the right person. I know, it sounds ridiculously obvious, right? But you'd be surprised how easily mistakes can happen. So always check the MAR chart. Look at the name, look at the photo, and then if you can, just ask them, confirm their name. It's a quick 2-step check that can prevent a world of trouble.
Number 2, the right medicine. This means you physically pick up the container and compare it to what's written on the MAR chart. Does the name match perfectly? Is the dosage strength what it's supposed to be? The golden rule here is never ever assume. You have to check.
Okay, third is the right dose.
The MAR chart will tell you the exact amount needed, let's say it's 500 milligrams. Your job is to make sure what you're giving matches that. So if the tablets in your hand are 250 milligrams each, the right dose is 2 tablets. It's simple math, but getting it right is absolutely critical.
Fourth on our list is the right time. You know, medicines are designed to work on a specific schedule. Some need to build up in the body, others need to be taken with food. Whether it's every 4 hours or just once a week, sticking to that schedule is key for them to actually work properly and safely.
Number 5 is the right route. And this just means how you give the medicine. Is it a tablet to be swallowed? Is it a cream for the skin? A patch? Getting this wrong isn't just ineffective, it can be downright dangerous. The route is just as important as the drug itself. No question.
And last, but definitely not least, is the right to refuse. This is about dignity and choice. Anyone who has the capacity to decide has the absolute right to say no. And our job is to respect that decision. We might gently encourage or explain, but ultimately, we respect their choice. And then we document it clearly and follow our company's procedure.
Okay, so you've nailed the 6 rights check. Fantastic. But the job isn't quite done. The safety process is a circle, and we need to close that loop. And that means talking about storage, disposal, and records. When it comes to storage, it's all about 2 things: keeping the medicine effective and preventing anyone from misusing it. So, what does that look like? Well, you always follow the instructions on the label. If it says refrigerate, you refrigerate. Everything should be in a clean, secure, locked cupboard. And those controlled drugs, they get the VIP treatment, a double-locked metal cupboard that's literally bolted to the wall. That's the standard.
We've been talking about the MAR chart a lot, so let's be super clear about what it is. It is not just a to-do list. It is a legal document. It is the official, permanent record of every single dose of medication administered. That's why it has to be crystal clear, 100% accurate, and, this is so important, you sign it at the moment you give the medication. Not 5 minutes before, not an hour later, right then and there.
All right, as we start to bring this all together, let's pull back from all the rules and procedures for a second. Let's talk about what this is really all about. It comes down to the heart of what you do every day, your commitment to care.
I think this quote just nails it. Medication awareness isn't just about ticking boxes and following rules. All of it, the 6 rights, the MAR charts, the locked cupboards, it all points to one thing: maximizing the good that medicine can do and minimizing any possible harm. That's it. That's the goal. That's what real compassionate care looks like. So I just want to end by saying thank you. Seriously, thank you for taking the time to focus on these skills, for your dedication to getting this right. The work you do is so incredibly vital, and when you do it safely, you make a world of difference. Never forget that. Your diligence, your attention to detail, you are the ultimate safeguard.
Thank you for joining us at UK Care World. Don't forget to subscribe and come back for new lessons, skills, and insights every week, supporting you so you can better support others.